Good afternoon. Welcome to the Monday, June 5th Health and Human Services Committee meeting. Second, Pledge of Allegiance. Please rise. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you very much. Next, number 3, adoption of the agenda. We need a motion to adopt. We have a motion by Leonetti, support by Carabelli. All in favor? Aye. Oh, please vote. Sorry. Thank you. Thank you very much. Hopefully, yes. Number 4, approval of minutes dated May 8th, 2017. I know everybody's gone and read through them. Do we have a motion to approve? We have a motion by Brown. Do we have support? Support. By Romano. All in favor? Please vote. Sorry.
You're setting us up.
Thank you very much, one and all. Next, number 5, public participation. 5-minute maximum per speaker. Please address this, whatever is on today's agenda.
Hello, Macomb County Board of Commissioners, Health and Human Services Committee. My name is Joseph Hunt, 8306 Stanley, homeowner and taxpayer, City of Warren, County of Macomb. I'm going to address the issue associated with the Area Agency on Aging 1B, or the AAA program. I know within the last month there was the question there over at the May 24th Finance Committee, where there was a reduction in the services that are available, especially to seniors, in the form of Meals on Wheels and the chore services. I'm going to echo my same sentiments that I did at previous meetings regarding funding for much needed services to many of the people that live in the City of Warren and the surrounding communities south of 14 Mile. That basically, I'm looking at the page here, 68, where it actually shows the breakdown of the allocations to Macomb County, and I see the shore service is at $130,000, and I really don't see Meals on Wheels on here. And I guess my question would be getting back to the community development block grants that the County of Macomb and the City of Warren are allocated each year, on whether or not that the Planning and Economic Development Department and the City of Warren have gotten together to all of a sudden arrange for the Meals on Wheels and chore services for seniors. In light of the fact that there's been the alleged reduction over time in provision of these services to the people that need them the most, my question would be as on whether or not this Board of Commissioners, as fiduciaries of the taxpayers and keeper of the funds, actually are aware of the waiting list that might exist, and whether or not that can become public information in the near-term future. Thank you.
Thank you. Anyone else in the audience wishing to speak? Going once, twice, thrice. Seeing and hearing none, public participation is closed. Number 6, MSU Extension Overview of Services and Annual Report.
Good afternoon.
Good afternoon.
My name is Edward Scott, and I'm with MSU Extension. I am the Associate District Coordinator, serving in District 11, which encompasses Wayne, Oakland, and Macomb counties. I believe you should have my slides up on your screens now, right? Okay, so this first slide is just a quick piece to let all of us know that we are an affirmative action organization and that our programs are open to everyone without regard to race, religion, gender, et cetera. And we make it a point to try to promote our programs and to recruit for our programs in an effort to reach parity with the surrounding communities. So today I'm going to give you a little bit of an extension overview for those of you who may not be familiar with us, as well as some quick highlights from the annual report. A copy of it has been provided with the agenda, and I've also provided hard copies for each of you at your seats. The mission of Michigan State University Extension is to help improve the lives of citizens through an educational process that applies knowledge to critical issues, needs, and opportunities in local communities. Some quick history about Extension. MSU was founded in 1855 as the Agricultural College of the State of Michigan. In 1862, 1890, and also 1994, the Morrill Acts established the land-grant university system, whereby universities were established in order to help our agricultural population learn the best practices and provide higher yields in order to feed our country. In 1912, the Michigan legislature gave county boards the authority to appropriate funds for extension teaching and research. What they found was that these land-grant universities were doing phenomenal work, great research into corn production, tomato production, how to preserve these foods, but it was all kind of staying on campus. And so, you know, if our campus is in East Lansing and you lived in Grand Traverse County, there was no way for you to take advantage of that. So in 1912, the Michigan legislature gave county boards the ability to establish county agents, whereby people would come from campus out into the field and be a resource for local residents. In 1914, Congress established the cooperative extension system through the Smith-Lever Act. So taking the model that was established in Michigan, they transported that model nationwide and replicated it. Just some more quick history. So the Cooperative Extension Service initially was focused on agriculture, home economics, public policy and government leadership, 4-H, and economic development, as well as coastal issues that we look at today through our Sea Grant programming. Extension consists of experts throughout the entire state and has for over 100 years. We have access to faculty and staff members throughout the state as well as on campus, and they help to respond to local issues such as agriculture, children and youth development, health and nutrition, and community and economic development. We also do quite a bit of work around business startups and product development and expertise. In 2014, we had 232 small businesses start up after utilizing our services in the state of Michigan. Each year, the university is able to put on an event called 4-H Exploration Days, where we reach every school in the state and we gather 5,000 youth on campus for a single event. They all come to campus, they spend 3 days living in the dorms and attending classes and learning about college life and also other various 4-H subjects. We're broken down organizationally into 4 entities that have different programmatic focuses. We have our agriculture and agribusiness programming, which focuses on animal agriculture, farm business management, understanding fruit and field crops, consumer and ornamental horticulture. We have our Greening of Michigan Institute, which, if you think about the things in Michigan that are green that make it great, we have natural resources and our economy. And the focus here in the greening is on understanding our natural resources, understanding our economic development and our food systems, and how to make those things grow and thrive in the state of Michigan. Our Children and Youth Institute encompasses what you all may be familiar with as our 4-H programming, but also some of our early childhood programming and our child care training programs. Our health and nutrition programming encompasses providing knowledge and resources to people who are on food assistance to help their food dollars last longer and to help them make healthier choices. It also includes some educational resources around social and emotional well-being, as well as parenting classes and anger management. In addition to kind of working around these 4 focus areas, MSU Extension also responds to emerging issues. We were some of the first boots on the ground with respect to the bovine tuberculosis crisis that happened a few years ago. In 2014, because our winter was almost non-existent, and then we had some refreezing, there was a severe effect on local fruit production, and we assisted our agricultural community with managing through that. helping to reduce the risk of avian influenza. Some of you may remember that last year, or possibly the year before last, I'm sorry, my memory fails me, but our local fairs had to completely do away with any of their poultry shows. And a lot of our youth who were raising chickens and turkeys and ducks were not able to bring them to the fair because of the avian flu outbreak. We were some of the first boots on the ground to respond to the Flint water emergency. And because of the work that we had done in the Flint community, particularly with the low-income population, we were a trusted resource when the residents, did not want to hear what the governor had to say in terms of the water being safe and ways to remedy the lead contamination. We were there to be able to provide high calcium recipes for people to take advantage of. For those who may not be familiar or who may not understand, calcium is one of the remedies to lead poisoning. It helps to leach lead out of the body and eliminate it. And so we were able to work with the populations there to introduce higher calcium diets. We worked with the United Dairy Industry of Michigan to provide over 1 million gallons of milk for free to the residents, as well as various high calcium pieces of produce that we're able to introduce into people's diets. MSU Extension statewide consists of 14 districts, and you can see the way the state is divided up there. Here in Macomb County, we are district number 11. Oakland, Macomb, and Wayne counties. There are 2 district coordinators, Richard Wooten, who some of you may know, and also myself. We have recently restructured our leadership here in the district, and Richard is going to be focusing on Wayne County and particularly the city of Detroit, and I will be focusing on Oakland and Macomb counties. And so get to know this face, because I will be in front of you more often than not. Just some quick highlights from the annual report from the programming that we did in 2016. Our 4-H and youth development programs served over 10,000 youth. And they did it through a combination of our incredible staff, but also 539 4-H volunteers. These are people who have submitted to background checks and who've gone through 5 3-day modules of training around youth development and what it takes to develop meaningful relationships with young people. And we're planning for Michigan's future. We're raising the next generation. Our natural resources and Sea Grant programs served 4,115 Macomb County residents. And also some of that service included 236 volunteers. Now, our natural resources programming is fairly diverse. It consists of anything from our summer discovery cruises and Great Lakes education programming to seminars about wastewater treatment and septic fields and understanding those things and how they affect the way that we live. Our health, nutrition, and wellness programming served 5,666 Macomb County residents this year. That's 5,666 residents who have a better understanding of nutrition and how physical activity plays a part in their health, and who are learning different and better coping skills to manage their anger and the stresses in their lives. Our community development and financial stability programming reached 1,202 residents last year. That includes over 100 residents who were served through a partnership with the Macomb County Treasurer, whereby we provided foreclosure counseling and helped people to apply for funds in order to save their homes from the county tax process. We're really proud about that. But that also includes people who just were seeking general knowledge about how to better manage their finances. I mentioned earlier small business development, and through the MSU Product Center, we worked with 40 residents last year in Macomb County to launch food products. Okay, our MSU Product Center helps provide education around Michigan's cottage food laws. It helps shepherd people who have an idea for a food product to market. And this all culminates in a small convention that we hold each year where we invite buyers from Meijer, Kroger, and other local outlets. Our community food systems work served 1,365 people. Through this work, we are helping to eliminate food deserts, that is, communities that don't have access to things like fresh produce and healthy foods. And we're also working with local growers, both large scale and small scale, to find ways to make sure that their produce ends up in local institutions, schools, hospitals, factories, anyone who has a cafeteria. We work to make those connections. Consumer horticulture programming served 1,431 people. That's 1,431 residents who received some kind of educational counseling around gardening and home food production. Our Master Gardener program reached 7,182 people through 416 volunteers. We run a Master Gardener hotline where anyone in the county can call us, and we can identify that weird bug or that strange weed that you found in your yard and you're not sure what it is or how to get rid of it. We can help identify that and also help identify ways to eliminate it. Our Master Gardeners, those 416 volunteers, they put on programming of their own once they've finished their training as volunteers. And through that programming, they reached 10,561 residents in Macomb County. Now, we don't always include that in the total simply because the way the data is gathered, we're not able to account for duplicates. But that is a vast reach, and we're very impressed with that. All told, we served a total of 33,244 Macomb County residents this year. And that's up from the previous year, which was 28,939. So in closing, I just want to thank you all for your time. We're very grateful for the partnership that we have with Macomb County, and we absolutely look forward to continuing to find ways to serve Macomb County residents. As I mentioned at the beginning of the presentation, I'm relatively new in the role, but I am open to any questions, and if I've got an answer for you, I'll give it to you.
Thank you very much. This is a receive and file. Do we have a motion to receive and file? We have a motion by Lucido, support by Drollet. Any comments or questions? Commissioner Brown.
What's the biggest project you have coming up that affects Macomb County?
Yeah.
Any MSU programming that's coming up, or something that's coming that isn't yet released? I mean, what's the next major focus? Or
you know,
you do a broad-based service, and they're all very well, and I'm familiar with a lot of them, and you do good work, so no complaints. But is there anything else coming up that maybe we need to know about?
No, there's not a particular focus. You know, this year will be very much more of the same. We'll seek to reach a wider audience. We always want to strive to have our numbers grow. So you can definitely expect that. I would say that our biggest hitters, would be the Master Gardener program. That definitely serves the most residents of any program that we have to offer.
Why all the management changes, MSU? It seems like they've been nothing but a continual series of management changes with the college, and doesn't reflect stability.
Yeah, I don't disagree with that. I can only really speak for what's happening here locally. There's a renewed focus on the city of Detroit. There's going to be, you may have heard about this, but MSU Extension and Ag Bio Research is going to be looking at installing an agricultural research station in the city of Detroit, and it'll be the first station like this in an urban setting in the country. And with all of the political complexity within the city, they felt that they needed to designate one person to help focus on that locally. And so given my predecessor's experiences with Wayne County and the city of Detroit, they decided to ask him to focus on that. I've been functioning myself in capacity as the associate district coordinator, so kind of as his right hand. And so I was here and able to step into this role. And we look forward to this being, more long-term than some of the changes you've seen over the past few years.
Okay, well, sounds like a good program where he's going, and that I wish them well there. So thank you very much.
Thank you.
Look forward to working with you.
Next, I have Commissioner Drollet, then Carabelli, and Smith in the wings. Okay. Commissioner.
Thank you, Mr. Chair, and thank you, Mr. Scott, for your presentation. How is the MSU Extension funded, and what amount of funding comes from Macomb County?
I don't have that exact number right off the top of my head, but I can tell you that our funding comes from federal sources, state sources.
Can you speak into the microphone, please?
I'm sorry about that. Our funding is a mixture of federal sources, state sources, and local funding provided to us through agreements with county governments.
Okay.
The amount of money that we receive from Macomb County, again, I don't have the exact figure, but the ballpark is about $875,000 per year in order for us to provide the programming that we provide here in the county.
Thank you.
Thank you. I see Mr. Smeagol in the audience. Would you have a number?
Not off the top of my head.
Thank you, sir.
I think Mr. Scott's generally in the ballpark.
I'm in the
Okay.
ballpark, yeah.
Okay, next we have Mr. Carabelli. I'm sure he wants to find out about those strange weeds.
That I found in your car, or? Thanks, thank you. Couple of questions here.
Couldn't help it, come on.
Who chooses the programs that you outlay in the county?
The residents do. We actually, last year, at the beginning of 2016, we led what's called an issues ID process. And that's something that we do about every 5 years across the state. In all of our local communities, we hold a series of focus group conversations to get an idea of what people would like to see from MSU. And we take that information, and then that becomes our, plans of work and our logic model for the next 5 years. And so that's how we solicit input.
Okay. Mr. Chairman, if I can keep going on this.
Sure, yes.
Your nutrition program. Explain to me your nutrition and wellness program. Just if you can touch on it and give me a
Sure.
10,000-foot view.
It's got a couple of different components to it. The main component is through our SNAP and FNEP programming, where we provide educational resources to people who qualify for SNAP benefits or FNEP benefits, Supplemental Nutrition Assistance Program benefits, or expanded food and nutrition benefits, so welfare and food stamps. And what we've seen sort of historically is if someone receives food stamps or welfare, those resources aren't always managed properly, and they don't make it to the end of the month. And so we provide education around ways to provide nutritious meals, and also which items to purchase that will last through the end of the month, provide the necessary nutrition. A piece of that is also working particularly with youth and with women around increasing physical activity, getting more exercise, eating right. And then the last piece of that is our social and emotional well-being programming. We actually partner with the courts in some cases, but also it's open to communities, and people are referred to us for anger management and parenting classes.
Okay. I know you're not going to have this information with you today, but when you get the opportunity, you explain that we went up, I think you said from 28,000 up to 33,000 plus that you're working with. On those numbers, can you let me know the piece of the pie that Commissioner Drollet talked about, how much are we funding on our behalf, and you got matching federal dollars coming in, and being that it's Oakland, Macomb, and Wayne that you're working in all together, I'd like to know the breakdown of the percentage of last year and this year of how many residents in Oakland, how many residents in Macomb, and how many residents in Wayne, to see the cost of what's being put in and what dollars are being touched back here in Macomb.
Okay. All of the numbers that I provided for you today, those are strictly Macomb County.
No, I understand that.
Okay.
But I want to know how many in each other county. So is it you're only doing 20,000 in Oakland and 20,000 in Wayne, and we hit it large at 33,000 you worked with here in Macomb, or is it the opposite? So I'd like to see across the board how we're fitting into a three-part group if we're getting our 33.33%.
Sure.
If that makes sense.
Yeah.
Your breakfast to farm, you talked about getting the food from the farmers out and get it sold locally. Have you worked with the Meals on Wheels program here in the county at all, as far as trying to get some of the fresh fruit and stuff sold to them?
The short answer is yes. We've done a couple of different things with Meals on Wheels. We help find resources where there's surplus food items available for Meals on Wheels. Our staff sometimes volunteers and delivers the foods. Macomb Community Action, is a part of the same department that we're housed under, and we collaborate with them. I don't know that I can say with certainty that we've actually worked with Meals on Wheels to connect them with the farmers, though. So that's absolutely something we can take a look at.
Okay. And one of the last two things is your home ownership counseling foreclosure. You hit about 1,200 this year, 1,202.
Mm-hmm.
I'd like to see the last 4 years of numbers of how many people you help. Starting from the downturn, obviously it's gone down. And is there something we're putting in place to help educate before someone gets into the problem instead of after the fact?
Sure.
Have you guys looked at beforehand instead of after the fact?
Yes, actually, we provide, so I simplified it for purposes of the presentation, but in terms of homeownership counseling, we provide pre-purchase classes for people. It helps them understand the mortgage process, what things to look for in a house. Participating in our pre-purchase classes actually provides an opportunity to take advantage of some HUD dollars for down payment assistance. So we do make an attempt to educate people before they get into the house. Once they're in the house, it's sort of up to them, and then if something goes wrong, we try to catch them at that point as well.
Thank you, Mr. Chairman.
Thank you, Commissioner. I got a number for Commissioner Drollet. It's for 2017. It's about $936,000.
About $30 a count.
Thank you. Last on the agenda is Commissioner Leonetti.
Thank you, Mr. Chair. Mr. Scott, I'm looking at this handout that you gave us here.
Yes.
And on page 18, it talks about the Macomb County Blue Economy Initiative.
Yes.
What do you foresee any change? I mean, this obviously indicates some of the things that were done last year.
Mm-hmm.
Are there anything on your agenda for this year that's going to continue to promote Macomb County's Blue Economy Initiative? Do you have any ideas off the top of your head that you can tell us about?
I'll be honest with you, I do not.
Okay.
I'd be happy to follow up with you, though, and provide that information. I guess I would answer similarly to the way that I answered Commissioner Brown's question. You can absolutely expect more of the same with an effort to increase our numbers and our impact. But in terms of specifics to enhance that, I don't at this time.
Okay, fair enough. Thank you.
Yep.
Thank you, Mr. Chair.
Thank you. Any other comments or questions? Second follow-up question, Commissioner Drollet.
Thank you, Mr. Chair, and thank you again. Of the programs that you administer, which of the ones do you consider are the most expensive to administer or to operate? The MSU Extension, the home foreclosure, the food education. Is there some that stand out as far as cost or?
I would say that any of our programs that have to do with youth, any of our 4-H programming, our early childhood programming, those tend to be the most expensive. They're resource heavy. They take quite a bit of time in order to reach the desired outcomes.
Okay.
And so, given the fairly large number of young people that we work to serve, I would say that would be where the bulk of our resources tends to go.
Thank you. And if just one last little question, that's of the 1,200 homeowners that you helped assist with potential foreclosure issues, do you have a number as to how many ended up avoiding foreclosure as a result of the program?
I can get that for you. I don't have that number today. And just for clarity, it wasn't 1,200 people who went through homeownership counseling. It was 1,200 people who participated in any of our economic development programming. So it could have been, financial literacy. It could have been the pre-purchase homeownership program. It could have been someone that we worked with through foreclosure. But I can certainly provide that number for you in terms of how many of the people we specifically worked with who were able to avoid that.
Yeah, it'd be nice to see the results. Did these programs actually end up helping them? So,
Yeah, most definitely.
thank you very much.
Thank you. Seeing no more comments or questions, we have a motion and support to receive and file. Can you vote, please? Okay, what do I got to do here? Thank you very much. Thank you very much for your presentation. Well done.
Thank you very much.
B, community mental health funding update. Director Kinch. Good afternoon.
Good afternoon, Mr. Chairman and Board. Thank you again for my opportunity to give you an update on community mental health. And as I get familiar with your system here. This is the update as I have today. My numbers are moving readily for each month that we do our reporting in the department. I want to introduce Cynthia Mack. Cynthia is the Chief Financial Officer for Macomb County Community Mental Health for last year, doing an outstanding job for us. She's here to support me if any difficult questions come up.
Sorry to interrupt, we just have to hit F5.
Okay. And so she'll certainly be able to help me out if anything comes up. Always wanted to start with our missions and value statements. Some of these things you've seen before, but it's good orientation, good recognition for the board to see it again. You know, guided by the values of our consumers, we try to support our consumers with community participation, self-sufficiency, and independence. So when we look at all of the activities of our consumers, we certainly want them to be as independent as we possibly can make them. As you know, we are a unique bird in our own right. Community mental health in Macomb County, we're a community mental health services program that actually delivers the services. We have 510 employees that actually deliver services to our network, and I'm going to talk about the finances about that in a minute. We're also a prepaid inpatient health plan, so we're a managed care organization, and we have the financing to support not only our direct operated staff, but also all of our contractors as well, the Henry Ford Health Systems, the St. John Health Systems, and the like. And again, we are servicing those consumers with the most serious of conditions, most serious affective disorders and thought disorders. Generally speaking, our consumers are with us for quite a while, and it's not as though they're here for 6 months and they're gone. They may stick with us for many, many years. We also serve the mild to moderate population, those consumers in our My Health Link demonstration, and those folks have a little lesser of a psychopathology going on, but that's the network of folks that we do serve. We have an extensive website, and I would encourage you at any point in time, if you want to learn more about Macomb County Community Mental Health, certainly go to that website. And as I indicated, there are 10 PIHPs in the state of Michigan. Those 10 PIHPs support financially the 46 community mental health services programs. They also support hundreds and hundreds of providers throughout the state that also contract for services. They are the managed care organization. As in Macomb County, we're a standalone, I've said this before, a CMHSP and a PIHP. That map you've seen again before, it's very telling. We are not Lapeer County, we are not St. Clair County. Macomb County, Oakland, and Wayne are very unique in right to relative to the services that they provide and the management of the system of care. And particularly Macomb. Nobody else does what Macomb County out of all 83 counties in the state of Michigan. So that map, I always use that. It's kind of telling where things are at. We talk about Medicaid rates and Medicaid rate setting, Medicaid rebates. Just a quick overview. Medicaid rates are drawn from the state through an actuarial analysis every 2 years. State of Michigan has to do an actuarial analysis. They're certified. The rates are certified by the federal government as being actuarially sound. They're not up for debate. We do participate in the rate setting process. One of my administrators, probably Cindy, sits in on the rate setting process. That allows us, once the rates are determined through all the PIHPs, the 10 PIHPs, that allows us to draw down those Medicaid rates with state dollars to be in the federal financial participation. And once they're approved, they're final. There's no other debate with that. So as you've heard me and other CMH board members and yourselves and legislatures talk about the unfairness, what it perceives to be the unfairness of Macomb County CMH and our rate reduction, CMS said the rates are fair. So live with it. They're not debatable. And I'll get into that a little bit further as well. And just a quick overview. Back in early 2000, the PIHP, they were funded entirely on their spending patterns. So you think back 17 years ago, if you spent $200 million worth of services, you received $200 million worth of funds. And so as the other counties started to draw more and more attention to thinking that the metro region really has the majority of the money, which they do because they have the majority of the consumers, they also are looking for politically and through righteousness of their own to have more state averaging so that they get more of the monies to treat their population as well. So this rebase that's been going on has been going on for a while. They started looking at comorbidity factors, and they have numerous comorbidity factors. I just threw a few of them down here just to get you a general idea of what comorbidity factors were related to historical and future spending habits. In 2010, under a capitated model here, it was 2/3 spending, 1/3 comorbidity factors that were rolled in. In 2011, they went to a 50-50 distribution, 50% comorbidity factors, added factors, and 50% funding. And then in 2014 is where the rub comes in. In 2014, it was an entirely comorbidity and other related geographic factors, prevalence factors, treatment unit factors that resulted in our financial situation that we're in. So prior utilization of services is no longer a predictor of future utilization of services. So that just took effect in 2014 and is playing itself out right now. So when we talk about movement to statewide averaging, there's Medicaid rate setting is synonymous with Medicaid rebase, which is synonymous with Medicaid redistribution. You hear all of those terms. They're all one and the same, and I think that's important to notice here. In the 2017, 16, and 17 budgets, when they removed the utilization factor, it affected Macomb County more than any other community mental health services or PIHP out there alone. Some of the other programs were affected minimally. We were affected by the amount of 17% reduction. So what did that happen? What happened to Macomb County? Severe reductions in Medicaid funding. It really required detailed person-centered planning. You should have that all along, but it really requires detailed person-centered planning to make sure the supports coordinators, the case managers actually have everything that they need in that consumer's plan right down to the detail. If not, it's not going to get approved. Aggressive utilization management practices. I italicize that because that's the best word I can think of. I think of all types of different words I could use to really describe how we do utilization management, but I have to tell you it is the most aggressive form of detail that we're attending to these person-centered plans or the services isn't going to be authorized. The largest reduction is in community living supports. We've affected probably the lives of 2,000 or 2,200 people in some way or another, either lesser or more amounts of CLS reduction, community living support. It's been a negative impact on our families, our consumers. You see them on the news, you hear them on the radio. They're contacting our legislature. It is what it is. We have to correct for that imbalance of that $33 million reduction. It's affecting our partnerships with our valued service providers, and I'll explain more about that later on. I mean, as far as what we can offer up them in the way of competitive rates. Challenges to be able to offer competitive wage, particularly for your direct care workforce. I've talked to you about the direct care workforce crisis that's here in Macomb. It's in the state, and it's going on throughout the country. There are not enough direct care workers in all of our service populations to be able to take care of our needy people. It's an imposed hardship that's just a repetitive hardship on families and those supporting their families, members, and trying to cope. And it's compromising our services. This one I'm going to have to scoot down here so I can see it. Does it show on your screen? Yes, it does. Okay. So this is, and I apologize for this, it was kind of a cut and paste. So this is where our spending goes. And so if you look at residential treatment, that first number, I think it looks like $64 million. $64 million worth of services goes to residential treatment. We have 120 group homes, and those consumers are receiving care 24/7, 365. You look at the other, these are just, it's kind of an executive brief of a utilization analysis, and for your purposes, that shows the largest funding sources that are in there. Our total contracted amount in our network, I think that's 158 million, if I'm seeing that correctly. Mm-hmm. So that's, again, all of the group homes, all the CLS providers, inpatient, outpatient providers, skill building, OTPT, speech language, all of that's contracted out. The direct network, that $29 million, that's the staff that are employed and the contractors, the professional supports contractors that are employed by community mental health. That's the CMHSP side, $29 million of direct operated services. Most of those folks are county employees. And there's around 510, about 350 of them are county employees. So my administrative costs and board costs are about $14 million. It's a little high for me right now. I won't go into it, but I'll be more than happy to entertain a discussion at some point in time why the PIHP has ongoing administrative challenges and requirement by the Department of Health and Human Services relative to the management of the PIHP operation. There are more and more functions that they're delegating and passing downstream to us, non-paid, and they expect us, and we have been picking it up under administrative costs. The board, the CMH board, likes to see that administrative cost closer to 5 or 6%, and it hasn't been at 5% in a long time. And I think that number is around 7.6% admin cost right now, a little bit higher than I want it to be. So the total, I think the bottom line, I think that says $210 million. So that's kind of where our monies are going. The bad news, there's good news coming up here real quick. The bad news is when we closed out last fiscal year on October 1st, on September 30th, we were projecting, and I'll walk you through this real quick. It's a pretty easy read. If you look at the center column there in 15-16, our actual revenue in 15-16 was $185 million. I'm just talking straight Medicaid. I'm not, and I'll talk about that more so too, not to confuse the issue. Straight Medicaid, $185 million. When we finished up on September 30th of last year, when we closed that fiscal year, we had $15 million in fund equity in our internal services fund. So we carry that $15 million over into 16-17, so that's revenue in the bank. And it's part of our risk-based contract, the money has to be there. Then you can see the next yellow box there, our actual, or not our actual, but our projected revenue for this year is $152 million, just in the Medicaid side. Now, there's a lot of moving variables here. If there's increased enrollment, we get more money. If the enrollment goes down, we get less money. The rates are changing, the per member per month rates are changing. But you can see as a quick read there's $33 million differential what we received last year than this year. So by the time we look at our expenses of $24 million, we were looking at a deficit of $10 million. We burned through everything that we have, and we were going to spend our 7.5% on our risk and go into the state's risk corridor. We can't come out any lower than being zero. And we were going to be into the state's risk corridor to the tune of $9.8 million. That's what we started October 1st, if we did nothing, if we stood flat-footed. We didn't stand flat-footed. So here's where we are now through mid-year. So this report was just drawn up. There's a revised picture of this that's making it even look better yet. But the revenues stayed the same, but the expenses dropped by about $10 million. And so before, in the previous slide, that revenue to expense projection was a negative $24 million. Now it's at a negative $14 million. So where we're at right now, mid-year through this year, is that we actually have $80,000 in the bank. So we corrected for that $10 million in the first 6 months. And how do we correct for it? It's primarily on the backs of the consumers, but I'll explain that in a few minutes too. Not all on the backs of consumers, but the reduction of their CLS services, the aggressive utilization management of their CLS services. So this is good news. It's good news from a financial perspective. Yeah. As a CEO, I sit here and I'm, very unsettled with what we have been doing in creating hardship to our families. I get that. It's not what we're here about, is to create hardship. They already have it hard enough. This is Healthy Michigan. So there was Medicaid. This is the Healthy Michigan piece. So we're showing there was a little bit of a reduction, maybe an increase I can't see, but we have about $1.1 million in Healthy Michigan, which is the Medicaid expansion. This is both of them combined. So this is what you're looking at here at mid-year status. If you combine the Medicaid and the Healthy Michigan, our fund equity is about $1.2 million. We have to get up to 13. This is general fund. There's the good and the bad. I'll tell you what. When you see me like you fixed one problem, another one pops up. Not too many years ago, we had $26 million in general fund dollars. And then when Healthy Michigan came around, they brought that number down to $14 million, then revenue $9 million, and now it's $8.5 million. A few years ago, not to my liking, we ended up lapsing money back to the county. We lapsed money back to the state of Michigan. That was a bad day. Last year, we carried forward the $890,000, and right now I'm projecting a $3 million deficit in general fund. And that's going to come down. We're correcting for that as well, too. This is mid-year status report. That is related primarily to our efforts to grow roots under our urgent care behavioral health clinic. We have an urgent care center that's open 24/7, 365. We talked about that before. I think it still has the opportunity to be a great community model, state model. There are others that are out there. I think it is going to be important to our future to have that, just to be able to get it to grow roots and not have me charge a lot of it to the GF is a problem for me. So I have to fix that, and I'll bring that number down, but I could be a little bit in the red on general fund. I skipped a slide in there someplace, but you had it. We're servicing about 22% of the Macomb County population in Medicaid. And someplace I had skipped that in my presentation here, but I didn't want to lose sight of that. So the 860,000 people in Macomb County, between Healthy Michigan and Medicaid, 22% are being served, are enrolled and eligible for services, and then should they need services from community mental health, we would provide them. So, the necessity for a risk management strategy, you look at that second bullet there, the department expects that we maintain a reserve, a risk management reserve that is adequate, necessary, and reasonable whenever possible to cover our risk exposure. So if we have $160 million next year, I have to have monies to cover my risk exposure. And it's kind of getting tricky right now because I've been working with the Macomb House and Senate delegation. I have a meeting with them tomorrow night. And they're all wanting to know, why is it I continue to press for $12.5 million and if I'm just going to put it in the bank? The legislative liaison for the department, I won't say what she did, but she was very unsettled that I needed the $12.5 million to put it in the bank. Well, that's not the case. The fact is that we continue to cut services very aggressively to our consumers. Mm-hmm. To have our financial risk reserve fully funded come this October, I need right around $13 million. I showed you I have $1.5 million. So that $12.5 that we've been asking for the last 18 months still rings true. So what are we doing? We're going to continue to use utilization management practices on our CLS. So you'll probably hear more people that will come before the board, to the Community Mental Health Board in particular. A lot of them are being very vocal, and rightfully so. Probably some more that'll be on the TV. We continue to utilize our acute psychiatric inpatient hospital whenever necessary. The urgent care center should be able to defray some of our costs. Our provider network reimbursement rates, I froze those at the 15 rates. They didn't get a rate increase in 16. They aren't getting one in 17. So the board approved the freezing of the provider network rates at the 2015 rate. We actually cut the acute psychiatric hospitals by 5%. We cut them 7% a few years ago, and they continue to take our consumers, and we cut them 5%. We have soft hiring practices going on. The board's not interested in a freeze at this point in time, so it's soft. And in some positions, I needed to replace the CFO. We're going to replace the CFO. Do I need a clerical? No, I may not. So of that workforce of 510 people, I have about 56 vacancies right now. Voluntary furloughs. There's a good number of our staff who have not stepped up, they just don't need the money. They probably work for other reasons in the county, and so we have furlough days that are going on. Macomb Oakland Regional Center is about a $40 million contract. I've renegotiated that contract. I'm taking it to the Community Mental Health Board in June, on June 14th, and it really minimizes the duplication of administrative functions that are going on there, and also gives us a greater ability for aggressive utilization management of the services there as well. CMH board staff travel attendance has been restricted. We continue to be in compliance with all these things that are going on. We continue to be in compliance with our contracts with the state as a PIHP and a CMHSP, and with the integrated care organizations with the My Health Link demonstration. We will be financially solvent. I can see the light, and it's coming. It's been a hard get, and it's been harder on our families. And there's opportunity for some strategic planning and some reform. That's going to be an interesting time. And right now is an interesting time. I can explain that to you, too. I'll come right back to that in a minute. Been working very aggressively with the Senate and the House delegation on this $12.5 million. They get it. That 17% has never been, that's unprecedented. No community mental health services agency, particularly an agency that services vulnerable people, has ever received that kind of reduction. They understand that it was equivalent to $33 million. They continue to hold the department. A few of them in particular are holding the department in certain that they're working with us not only financially but contractually and technical advice. They haven't given us much technical advice yet, but and that we continue to pursue that $12.5 million. And we would need adequate funding for 18, 19, and 20. Where I talk about where it's going to get interesting in the system reform, we need to attend to our finances and our services in the county. We're not out of this yet. By October, I think I'll be able to give you a whole different picture on this. I think we're going to be able to have survived what we went through, corrected for our financial situation. We may not be whole in our internal services fund, but we're going to be a lot closer to whole than we were a year ago. It's been a deep dive here. I think we'll have adequate funding, or we need to make sure we have adequate funding for 18, 19, and 20. The other things, that's local, and then the other things that are coming out is when the conference committee comes out with their budget, and that's, hopefully they won't go in throughout the summer in the session trying to resolve that. But the state has to figure out their budget for mental health services, substance abuse services, and how they're going to afford those programs. And so we'll wait and see if there's additions or reductions. I know they're dealing with a statewide general fund reduction, how they're going to support those programs. We've talked about Section 298 before. I believe 298 is going to stick, and that the community mental health services programs will be around, and we'll continue to promote those core values, person-centered planning, community inclusion, all of those core values and things that we care about in the county. I also believe that Section 34 is going to be something where they're going to promote pilot programs throughout to be operated by the HMOs, pilot programs. I think that's the harbinger to privatization, and I also believe in my own mind, we'll wait and see, that 234 is going to call for a single PIHP, and that PIHP isn't going to be Macomb County. They're probably going to farm it out to an administrative services organization, an ASO, have an ASO run the whole state of Michigan probably by 2020. So $200 million that we're looking at, we're going to have to worry about that. We're only going to have to worry about that $29 million that's funded to the community mental health services programs. And then on top of that, they're moving pretty slow because no matter what they put in place, you still have to wait and see what the federal government's going to do. And the federal government comes out with Medicaid block grants, whatever they do with Medicaid eligibility and enrollment, that all gets trumped by the federal healthcare reform, if that ever does show up and come out. So the local stuff is going on, then you got the state issue, and then you got to see what the federal government's going to do. Oops. What we need now, you and I and everybody else, we need to attend to the local demand, awareness to community need. There are so many people out there that have emotional disturbances, serious mental illnesses, conflict in their lives that rise up to our attention. Families with disabled children who need support and needs, and then unless you're close to one, living in one, or spend a day with one, I don't think we really get the full gist of how challenging that can be. And it's not going to go away. And the more and more consumers are going to be, I think, stressed and need mental health services due to just the challenges in our environment, more and more substance abuse issues that are going on. We just all need to be really sensitive to what's going on in our community. The state needs to give us adequate funding. And then the Federal Health Care Act needs to have some sensible reform. we all need mental health.
Yes, sir. Thanks, John. Before we get into some of the questions, is there a motion to receive and file and support? We have a motion by Rolette, support by Myjack. I've got Commissioner Carabelli.
Thank you, Mr. Chairman. A couple of quick questions. Help me out for a minute. You had employees from community mental health, I believe, at the jail for part of their intake and their counseling or for identification, then you cut them. What were the numbers you had and what did you cut?
We had 4 FTEs that were doing mental health jail diversion, and then we cut that back to 1.5, and then the Board of Commissioners gave us $117,000 for funding for 1 FTE, if I have that correct. So we should have 2 people in there, either 1.5 or 2 people doing mental health jail diversion right now.
Okay. Question for the chair of the board, Commissioner Smith. Wasn't it something that was a recommendation from the program from the jail? Wasn't it about we needed to increase the number at the intake for diversion purposes? Did you get a chance, or did anybody give you the report from the jail study?
I do have it. I know it's a lengthy report, and I have not reviewed it, but I do have it, yep.
I respectfully ask that you have either one of your employees or yourself take a look at that, because one of the concerns that they had brought up to the Board of Commissioners is that I know you had done that reduction. They said that they needed more than what you probably had during the time of the original study, that we really need to keep a close eye out on that. The second question I had for you is the 17% reduction, $33 million in 2017. So the other counties all received that 17% reduction of that $33 million?
No, 4 or 5 of the counties actually received a rate increase. Those in the northern and western communities side of the state, as part of the rebase and the redistribution of funds. 2 or 3 of the counties received a 2% reduction.
Okay. Mr. Chairman, the reason I asked you that, I didn't really grasp it when you gave me an explanation of why. And I guess what we're doing in Macomb County compared to the other counties, I don't know if this is a sidebar that maybe you and I can get together and you can explain it to me so I can understand it, but it looks like we're doing something different than they're doing in the other counties, and they're saying we probably shouldn't be doing it, and then they're taking the money away. So again, you tried to explain to me once before here at the board, and I just didn't grasp it. So I guess I'm going to ask offline to get a better understanding of what we're doing differently here than they are in the other counties.
Yeah, sure. Let me know how you want to proceed with that.
Okay. Thank you, Mr. Chairman.
Thank you, Commissioner. Commissioner Toko.
Thank you, Mr. Chair. John, you'd indicated that there was a reduction in services and that you reduced the risk management on the backs of consumers and said you were going to circle back to that. How have you, so all of that has been on the backs of consumers?
Well, no, that was in one of the slides where I also highlighted that we're controlling for acute psychiatric inpatient hospitalization. I had the 56 vacancies, the staff furloughs, the restriction on travel, the reduction of provider rates, the freezing of the rates. So it's not all on the backs of the consumers. Far and away, the way to correct for the budget is on aggressive utilization management, but we have a number of other things that we've done as well.
Do you know like what percentage? I mean, is 60% of it in reduction of services, and what's the percentage of how that pie shakes out?
That's probably around, well, I said we corrected for $10 million, and I would have to believe that, probably $9 million of that is on CLS reduction.
About $9 million of it?
Yeah, probably 90%.
So what does that look like for the consumer? I mean, I know that they had lost, the last time I served on the board, they had lost overnight services.
Right.
What have they lost, what have the consumers lost since then to make up that $9 million?
Well, when we talk about the person-centered planning, if I can just walk you through it real quickly, when they do person-centered planning, we've been engaged in this all along, that the first order of business is they need to apply for home help services through the Department of Health and Human Services. So they may get an hour and a half or 2 hours a day of home help, actually helping them with personal care. And we factor out skill building. Skill building is a vocationally based program for 5.5 hours. We take that out. So now you're at 7.5 hours. You take out the 8 hours from, say, midnight to 8 in the morning when they're sleeping. So now you're at 15.5 hours of services where someone says they typically receive 24 hours of care, those 15 and a half hours have been backed out, and have been backed out all along. And then natural supports, when you start looking at the specificity of medical necessity, just because your child is developmentally disabled doesn't mean that the county has to pay for you and purchase your services for you. That a child is parents are expected to give their developmentally disabled or their developmentally disabled or emotionally impaired child the same care as they would give a normal child or one who doesn't have special needs. And so, we may take 4 or 5 hours out of there saying, well, you're asking for community living support services, to help your child go to bed at night. Well, you would help any child go to bed at night and get ready to go to bed. So it only leaves you with maybe 4 or 5 hours for some of those consumers or those families, because there's other supports and services that are there. And then because you have so many different people that you're dealing with, there's some folks that are, as I said before, cognitively able as you and I, with, spastic quadriplegia in a wheelchair and can barely move their thumb, and they live independently because they want to live in an apartment. And so we do provide them with services 24/7. We're asking them to think about a personal response system. So, if you're physically disabled and can't get out of your bed and we're asking you to push a button, you hope that the fire department gets to you before the fire does. And I just have a hard time with that. And I'd say before, if you're having irritable bowel or some type of diarrhea in the middle of the night, I think it's just shameful that we can't be there to help our consumers. Because if I know what I need to do in the middle of the night, if I have diarrhea, I got to get up and relieve myself and take care of myself. And that's what that's the ugliness of the system. You don't want to, support people's wishes to live in an apartment, and you want to take those hours away from midnight to 8 in the morning. Well, that's what we're doing to our consumers. And some walk out the door, they can walk into the street, they can let anybody in their house because they may not have the judgment. And I just think that's not something that's the best humane practice of what our service should be about.
And then, so obviously there are going to need to be further cuts to make up that $13 million this year.
Yep.
And how do you envision doing that?
Continued. See, the plans are coming through on an annual basis, or 6 months or 3 months. So as the plans come up for renewal, then we continue to look at the service. The service is not intended to be, you look at maintenance of, attainment of effort and maintenance of effort. When I interpreted that, and we're still have a review going on by the department. We'll see who's right here. I'm not giving up on that. When it says attainment of skill or maintenance of effort, if I can have a consumer living in their apartment on maintenance of effort and be independent, then that's the decision that we wanted to make. But the department is saying skill building services is not long term. So you gain your skill, and if the goal is to load the dishwasher to make you more independent, when you're done with that skill and you've mastered that skill, I'm not going to teach you, to continue to load the dishwasher or teach you other skills. And so I think you'll continue to see a aggressive utilization practice unfold. And so that's how you get to the remainder of the dollars. Now, if I can get the supplemental by the legislation to offset that, I think that there can be a smoothing here. Because right now, if somebody needs to be out of their apartment, I'm not giving 60 days, for an aunt or uncle or mother or father to go find another apartment, for their son or another, provision of care. It's 60, right now. It's no longer medically necessary. There is opportunity to say, well, give me a little bit of time to breathe here, and we'll give you 60 or 90 days to figure out another plan.
So then when these services are cut, and then my understanding is the consumers have an appeal process, correct?
Yep.
So what's going to happen if they win their appeal, and how does that affect the budget?
Well, they win their appeal, and we'll continue to afford to pay for their cost of care. We've had around 130 appeals, and I think we've been upheld on around 120 of them. We've lost about 10 of them.
So are you helping the consumers with their appeals then?
We reach across the table. Sure, there's an administrative law judge, generally from the state, that's on the phone. Sometimes he'll be in presence, in person. Our counsel, Aaron Thomas, with the executive's office, he sits and represents community mental health. The family, usually the sports coordinator, the caseworker is also alongside with them, trying to advocate for services. They may bring in an attorney in. It's not really high legalese kind of stuff, but they have a dialogue with the ALJ for about 60 minutes, and then the ALJ makes a decision. So we do help them, yeah.
And then, thank you. My last question is on the UBHC. Are you realizing the savings that you had anticipated by the establishment of the UBHC?
Our acute inpatient is coming down a little bit. I think we spent around $14 million in acute inpatient, and maybe 13 and a half, so maybe $500,000 savings on that. If we could attribute it all to
Point of information, I don't know QB, all this stuff, can you guys speak
Oh,
to something like?
Urgent Behavioral Health Care Center. The Urgent Behavioral Health Care Clinic, it was the question that we started over on Garfield. It's the 24/7, 365 program.
John, I don't think maybe a lot of the new commissioners don't know about the center. We had talked about it at Justice and Public Safety a very little bit, but I don't think that they know. I mean, can you explain how the county established that and who's running it? And
We direct operate the program ourselves. We led an RFP a couple times for an urgent behavioral health clinic, and the two times that it came away with a price tag of $4 or $6 million. So we said, let's figure out a way to do it ourselves. So that was about 5 years ago. In the last couple of years, we've been trying to get the facility, the staffing, and to be able to get the operations in place. If you're a consumer with severe psychiatric psychosis, or if you have major depression, you don't belong in an emergency room. You just don't need to go to an emergency room. You see doctors and nurses. You need to go see somebody who's a little bit more sensitive to what's going on with your psychiatric dysfunction. So we have clinicians that are in there, so we have psychiatrists in there. We have peer support specialists. Peers are people who have mental illness and have kind of recovered from mental illness. They've walked the walk, and so they can also help and greet and calm the situation. So the environment's much more calming. You want to ever come and visit it, you're welcome to do that. We have the capacity to see 12 adults, 3 children in warming, calming rooms. The intent then is to take someone who's in serious crisis and not, if they're at the emergency room, they're probably going to get admitted. If we can get if we can get eyes on that consumer in an urgent care setting, and if we can find out what's going on, we can offer that de-escalation, that desensitization, be able to have them, maybe identify their caseworker, or we can identify a caseworker. Maybe we can have them go to a walk-in clinic the next day, do a risk assessment, and redirect the consumers out of the acute psychiatric hospitalization. Therefore, maybe it costs $400 or $500 to provide that professional intervention. Comparatively, if they went on to a psych unit, it'd be $6,000 in the course of 10 days. So that's what we're doing. So back to your question, I believe that we probably dropped our acute psych utilization as part of the efforts of the Urgent Behavioral Health Care Center, maybe by about $500,000. There's a slow trending there. Is what the mark was? No, I think our mark was about $3 million. And what the unforeseen piece is that it's costing us a lot in general fund dollars to operate it. So I can only apply so many dollars to Medicaid. If 50% of the people are coming through Medicaid and 50% have commercial insurance or a general fund, I have to account for that accordingly. 50% there and 50% there. So it's an expensive program, and we're continuing to retool it. But there's not much of a margin there, and there's not much of a general fund budget. I'm over budgeted on my GF side. So just the expense and the operation of the program itself is a little bit of a challenge for me right now. But we're fixing it.
Thank you.
Thank you, Commissioner. Next, we've got Commissioner Leonetti.
Thank you, Mr. Chair. Couple questions, and forgive me too. A lot of times when you use the acronyms, I don't get them as well. So sometimes just tell me what the acronym is, and then I might understand what you're saying. The first question I had was related to the system reform that you talked about. You talked about Section 234, and you indicated, I think you said the term was AOS. I'm going to assume that's an administrative authority, is what you were saying?
Administrative Service Organization, ASO. Yeah.
ASO, yeah. Am I to understand, okay, and just so I understand a little bit too, okay, Oakland County has an administrative authority that handles their funds, correct? Right. And so does Wayne County.
Yep.
Okay, we don't. We're different in that sense.
Correct.
Okay. Are you saying that this act, this Section 234 thing that's coming down the pike, is this something that's going to eliminate us across the board with all these different Macomb, Oakland, Wayne? It's going to be one central ASO that's going to handle how the funds are going to be dissipated to the counties? Is that what you're saying?
If, when I look at what I hear in the network going on, correct, there was 18 PIHPs that had the administrative responsibility, the managed care organization, MCO, for the Medicaid dollars. That was reduced to 10 a few years ago. And if it comes out that way, based on what the talk on the street is, there would be one PIHP. And I believe that they won't just turn it over to one existing PIHP, and it would be turned over and they let an RFP for an administrative services organization to be the administrator of that. So all $2.456 billion of behavioral health monies goes to the ASO, and then they would set up common access. Everybody who's getting services is the same. They'd set up common CLS, so all the CLS is the same throughout. The billing mechanisms, the claim adjudication would all be the same. The provider network credential and privileging requirements would all be the same. But
now, if something like that happens, like this thing you set up, the urgent care behavioral clinic, that's something that we did on our own, right? You indicated it was something you decided to do as an independent mental health provider. Would we lose the ability to do something like that if Section 234 went into effect? In other words, we're going to be given funds from the central authority in Lansing, let's say, and then we have to decide how to spend those dollars, and assuming that we can afford it, we're going to do an urgent behavioral center, or we're not going to do an urgent behavioral center. Is that correct?
Correct.
Okay.
I believe the ASO would, again, set rates and expect the ASO is, part of tying back to the 298 section of the budget. Mm-hmm. The ASO would be required to contract with all the community mental health services programs, but not exclusively. They'll also contract with Easter Seals and Hope Network and anybody else out there who does the business. And so they may set the rates, and there may be particular services that they want or they don't want. The ASO may say, I really don't like the urgent care concept. Let's do a walk-in clinic. And so they'll be able to predicate what they want from us.
So in other words, we can't tailor it to what we think is best for our community. We're going to be stuck potentially with the standards from the centralized ASO.
Well, I think what we should do, and as I've been talking with some of my board now, we shouldn't do outpatient and a lot of services that we shouldn't do that are common to the network. I think that Macomb County Community Mental Health operates one of the best children's programs there is in the area. We do more children's waiver programs. We have a state model. Best practice standard for delivering children's waiver services to really complex kids, serious emotional disturbance waiver, really complex kids, the autism benefit, complex, infant mental health, complex. I think there's a marketplace in the future for children. Let's treat them when they're young. Let's treat children. I don't think we treat adult outpatients in an outpatient venue. I think crisis services as well, too. I think, any type of crisis-related service where we can go out in the community, urgent care, I think fits that model.
Fits that model.
Yeah, if they can keep people from higher cost acute inpatient. Yeah.
Mr. Chair, just give me a few more questions. I'm sorry, just a few. I want to go back to the CLS. And again, correct me, I'm learning this stuff as a new commissioner. Is there some conflict between what the state mandates and what the federal mandates in terms of CLS? Like, in other words, and correct me if I'm wrong, the feds want people to be more independent. In other words, they want them to be in their own home. And the state is now saying, look, with this utilization, you should really take a bunch of people and put them into one home, underneath one home, and have one care provider in there. Is that true? Is there that conflict between the federal guidelines and what the state guidelines are?
No, the federal guidelines are becoming more and more inclusive of choice of control, consumer choice of control than what the state guidelines are at this point in time. And everybody has to move in that direction. I'm going to sit here. I'm not going to be defensive, but I think that we've got it figured out. I think we're further ahead of the curve relative to the delivery of community mental health services in what the emergent home and community-based services waiver is expecting all the states to do in the coming years. I think we're further ahead. And time will tell.
That's
4 or 5 years from now, at some point in time, they're going to say Macomb is off base, or they had it right. I'm convicted that we have it right.
Okay, that's what you were saying when you were saying, I think my argument will stand in a couple of years. That's what you meant by that. Okay. One last question. The $12.5 million that we're short for the reserve, okay? What happens come October if we don't have that? What happens if we're not able to maintain our reserve? What's going to happen? What's the state going to do to us? What's the word up there in Lansing, if you know?
Well, it's that one slide that says I need to have the reserves to assure exposure to my risk. I'm going to continue with my aggressive CLS utilization management practices, and I'm going to find those dollars. I'll continue with my hiring freezes and my rate freezes and all of those types of things. We're moving the needle. Will I be fully funded? Will we be fully funded at $13 million? No. Will we be close enough that we can craft an internal a risk management strategy? It's another thing in our contract, a risk management strategy that'll get us a contract. Yeah, we'll get a contract.
Okay, so to answer my question, if we're close,
yeah,
we're still going to be able to maintain our independence. Is that what you're telling us? Okay, all right. Thank you, Mr. Chair. I have no further
Thank
questions.
you. Last, I've got Commissioner Smith.
Thank you, Mr. Chair. John, thanks for coming up today.
Sure.
I was up in Mackinac this weekend and had the chance to talk to a few people that were intimate with this situation. It's kind of funny that you mention it because they were saying that a few years ago, Macomb was the one to look at and emulate, and they were doing all the right things. And then all of a sudden, in a blink of an eye, we're the ones that are the problem. Spending too much. And it's amazing how things change in such a short amount of time with the same program that was in place that was so great to many people recently. So I have empathy for your position right now when everything was going and you're building, you're doing the right things for everybody, and then all of a sudden the rug gets pulled out from under you. I have a question. Well, two questions. First, the easy one, I guess, lobbyists. Are we working with our lobbyists here through Macomb, GCSI, on this, or is that how, do you have your own lobbyist? How does that work?
I use GCSI, Gary Owen, and it was just recently, just a quick story, I did meet with Nick Lyon, who is the director for the Department of Health and Human Services under Governor Schneider, and also the state Medicaid director, Chris Priest. I had a meeting with them on May 14th relative to our situation, where we're at. Gary Owen was there. Kathy Bartz from the county exec's office was there, and Kathy Vosberg, chairman of the Community Mental Health Board, too. And so yes, we are working with the lobbyists there, and Gary gave me some strategy on how we need to continue to move it forward. Nick Lyon said that our request was reasonable, so he would not stand in the way, or when it comes out of conference committee, would he stand in the way or strike our language for a request for $2.5 or $12.5 million. So we seen that as a win, that he said it was reasonable. I said, when do I stop coming up here? If I'm down to 15% reduction, do I stop? When I get to 9% reduction, do I stop coming to you? When do I stop? And it's at 17 right now. So he and Chris Priest, director of Medicaid, who doles out the dollars, they said they would not, the request was reasonable, they would not stand in the way.
Okay. Well, speaking of doling out the dollars, since it's the Board of Commissioners that do a little bit of that too, I'd appreciate it. Maybe a seat at one of those just to listen to what's going on up there
sure.
in this respect. And so back to Commissioner Toko's question about appeals. I imagine in the past appeals were kind of handled once if they were granted, we had the money to cover them. But in the future, if we're down to the line and a customer, or several of them win an appeal, are we mandated to cover that, or does the state then cover that, or the feds, or is it the same combination and we'll be on the line for it in part?
Well, it depends on the size of the numbers that we're talking about. Obviously, if you're looking at 2,200 people and 4 or 5 of them, 11 of them win their appeal, we'll find that money. We have to find that money to be able to support them. If it becomes the trend in that, that the appellant continues to win the appeal and I think I have that right, and that the department does not, then we go back to the department and say, look, here's the trend. Here's the shift that the ALJ is continuing to uphold the consumers because the consumers are right. And then I think we take a narrative and explain why is it that we're seeing more and more consumers that are being upheld by the ALJ, and what does that trend look like? And then it would have to eventually go back to the actuarial analysis when you start looking at all these different factors, comorbidity factors, treatment prevalence factors, all those comorbidity factors that come up into the rate actuarial analysis.
Okay. All right. Well, thank you.
All right, thank you. Any other comments or questions? We have a motion and support. Can you vote, please?
Thank you. Appreciate your support.
Thank you, John. Next, we have Animal Control Department overview. Chief Jeff Randazzo. Good afternoon, Chief.
Good afternoon, Chair, and welcome to the new commissioners. I'm just going to get to my little taskbar here, so I have a little display for you. What?
We've always got penguins around.
I know. Right, but it was a good support. So thank you, John, for that. So I'm just here today to talk to you about animal control. And also, again, I would like to welcome all the commissioners and just give you a little brief overview of what we do in animal control. Most of you know me, and I'm going to make this really brief for you. So, let's see. I'm Chief Jeff Randazzo. I'm the Chief Animal Control Officer for all of Macomb County. I have an executive assistant, Michael Hudson, who is here with me today. And we have 7 animal control officers. We have 7 kennel attendants. We have 4 office staff, and we have part-time veterinarians. So currently, we don't have any full-time veterinarians. What are our primary functions? Well, what do? We service 21 communities in Macomb County. There are 4 of the cities we do not service as far as putting an animal control officer in those cities, but we do allow every city and township in this county brings their animals to our animal control division here at the county. But again, those 4 communities have their own animal control officer who transports them to us. We house for those 4 cities. So even though they have their own animal control officer, we actually house them for the animal's duration. So after their legal hold time, they are then property of the county. We bill those 4 cities for bringing animals to us on a daily basis, but only for the legal hold time. So that means a dog is held for 4 business days. We might have that dog in our custody for 15 days. But after that 4th business day, the county, my department is now paying for the care of those animals, okay? One of our big primary functions is animal cruelty investigations. And we'll talk about that in the next slide, but animal bite investigations, rabies specimens. So this entire county, whenever there's a situation that involves rabies, so a person's bit by a dog, wildlife, it's a dog and animal to animal, it is filtered through my division. We send all those tests to Lansing. So earlier when you heard the gentleman talk about avian influenza, that was my staff collecting those samples for our county. We turn them into the state and also the DNR. We obviously license dogs. We obviously care for all the homeless animals that are in our possession. That also includes livestock. So we are one of the few counties, animal control divisions, that handle livestock. And just recently, we took out 40 head of livestock out of a farm in Lenox. So that's a really tasking thing to do, is find placement, permanent placement for all those animals. And to find it at 2 o'clock in the morning. We also do adoption. So a lot of the animals, even though we have strong relationships with rescue groups and Pet Supply Plus and Gibraltar Trade Center, we actually do adoptions right out of our facility. Other public service that we provide are private cremations, owner request euthanasia, roadkill removal. We're the only animal control division in the state of Michigan that removes dead carcasses from the roadway. Most of that's done by the Department of Roads. We assist with wildlife and concerns, so we try to get the residents to try to find some sort of harmony with living with wildlife, because as you know, it's usually going to be a big problem, especially this time of year when we have all the little babies. So just to give you a recap of 2016, how we look, we have a 91% save rate. So that's a really big deal for maybe the new commissioners or whoever else didn't know what it looked like 4 years ago. We had an 86% euthanasia rate. 86% of all the animals that walked into the building left out of the incinerator. Now, 91% of our lives are saved. And it really has to do with our entire staff, and the amazing support that we get. We did over 700 neglect complaints last year. We did almost 900 bite cases, and we did 1,000 animals at large. So it's running loose. That is not just dogs and cats. So last Thursday, if anybody was watching the news, we removed 4 hogs running on 24 Mile and Card Road. So that was quite a fun day at 7 o'clock in the morning. We take in over 4,500 animals a year. We are the second largest, highest volume animal control division in the state of Michigan. And we have a 91% save rate. So we are number 1 in the state of Michigan. So for open admission. So we take over 60,000 phone calls. So I had IT, Jaco just gave me a report last Thursday, because I just wanted to make sure I had my numbers right, because when I looked at it, I was like, this is really high. But just from January 1st to last Tuesday, my staff, those 4 staff members, answered 31,000 phone calls, with the duration of that phone call being 3 minutes and 13 seconds. And when you look at those numbers, it's over 800 hours of phone calls, just in phone calls. So that's a really big, important thing for us, that we're really that busy. Those same 4 people are doing adoptions, they're dispatching the radio, and they're taking in stray animals over the counter. And that's when we talk about doing a dedicated staff. They're truly dedicated. This is just some animal cruelty investigations that take up the biggest portion of our time. Everybody knows Elvira from last year when we took her in. But we do, most of the calls are animal neglect, animal cruelty, backyard breeding, exotic animals, pet shop complaints, and horse riding stables, which were mandated by law to investigate all of those. So, and it's not just dogs and cats that we just talked about. So, there's one of our little pigs. We have our little fawn there, some snakes, goats, and raccoons. So we have wildlife. But obviously, there's a lot of, still plenty of dogs and cats that we are, helping out there. What does it look like for when we do medical care for our animals? We use best practices that are provided by the veterinary schools and shelter medicine programs. So we partner with them, and they say every animal that comes into that building is vaccinated upon intake. That's why we don't have, kennel cough, like when I took it over, and we don't have MRSA or any other, staph infections. By law, every animal that leaves there has to be spayed and neutered under Act 287. So that's pretty daunting for us, because I do have a grant. We did receive a grant through the state to put in a surgical suite, so we have most of our equipment in, so hopefully soon this year we could start that. We test every animal for intestinal parasites, all the felines for infectious diseases, heartworm testing, we do all the blood work. In 2016, we treated which I know of off the top of my head, about 22 cases of heartworm, positive, dogs that were positive for heartworm. That's really big, because 4 years ago we didn't, we just euthanized them. So we were able to do that, work with, all these rescue groups and get those animals treated. We've treated everything from eye removals, broken bones, canine parvovirus, mange, and much more than that. So that's why we get to that 91%. As we mentioned earlier, Mount Clemens, Warren, Sterling Heights, and East Point, they have their own animal control, but they do bring all their animals that they have in their custody to us. And that includes their court cases, stray animals. All those animals are brought to our facility here at Macomb County. The animals that are in our care, they're treated, they're returned to the owner, or they're adopted out through our animal control division. So that's a really important key. Cities so Mount Clemens, Warren, Sterling Heights, and East Point, they do pay us a per day fee for those animals, but it's only for their legal hold time. So it's about 4 business days, which kind of translates to 7 calendar days. And then after that, those animals are the custody of the county. Currently, the city of St. Clair Shores, and then starting July 1st, Roseville, they're the only 2 cities in the entire county that pay for contractual animal control services. Nobody else pays, which we think there should, but that's a whole nother topic. We are the leader in our industry, especially for our state. We provide training to a lot of municipalities, such as Genesee County, Oakland County. We just started working again with St. Clair County to, in Detroit Animal Control to improve best practices. And so they do come to our facility. We do go to their facility as well to hopefully that, they could raise their level of standards as well. Because we know it can be done because we've done it here in Macomb. We partner with certification programs for continuing education. So we just had the University of Missouri here teaching at our police academy for a week, and obviously my staff went through it as well. But the whole goal is that we are trying to bridge this gap between law enforcement and the Macomb County Sheriff's Department so that we could have officers that are road patrol, learn about animals, their detective bureaus, learn about cruelty investigations, and really kind of, together really tackle some of these important cases out there and be successful at it. We do a lot of community outreach as well. We partner with a lot of schools, Macomb Community College Vet Tech Program, Baker. We are in talks with Michigan State University with shelter medicine programs. So we are doing a lot of great things. We also reach out to, the mail carriers, FedEx. We do a lot of programs for them, teaching about dog behavior, what they can do to protect themselves because they are not allowed to carry any sort of weapons. How do we do it? Once again, it is having dedicated staff. I feel as though the more and more I've been here, the more we are, and we have this positive outlook on our community and our state, we really attract some amazing people. I send my staff to training every year. I think that's really important, continuing education. I don't want them to hear it from me. I want them to hear it from the experts out in the field. And that's why we work with the University of Missouri in a lot of different places. We partnership with local rescue groups. And obviously we mentioned veterinary colleges, numerous grants, but you're going to hear another one today right after this. And but that's really important, right? Because it did, our program, I probably obtained over $700,000 in 4 years in grants. And that's a really big thing because we could have never got to where we are today without having those amazing grants. But mostly, the support from the Board of Commissioners and the Executive Office really makes the biggest impact on what we do because you allow me to be free thinking and you allow me to implement programs that are life-saving to the animals that are in our community. And that's how we get to number one. I can tell you that I've sat on many, many meetings just recently with St. Clair County, some other places, and it's really hard because you could have a lot of amazing ideas, but if you have a board that will stop you, you're going to go nowhere. So I truly applaud you for allowing me to have that organic and free thinking and reaching out to the community because in the end of the day, it really reflects all of us. And we want it to be a place that we're proud of. And this is certainly one department at number one in the state with a 91% save rate that you truly can be proud of.
Thank you very much, Chief.
You are welcome.
Is there a motion and support? We have a motion by Brown, support by Lucido. Number one, get on the list. Number one on the hit parade is Commissioner Romano.
Thank you, Chair. Thanks for coming, Chief.
Thank you.
Maybe you people don't know, but Chief Randazzo was our chief officer in Sterling Heights, and I still resent the fact he came to Macomb County, but I'm just teasing. Anyway, here's my questions. And I guess this would go first to the chair. This is a grant for $10,000 you're receiving, and I guess it goes to the board here.
That's the next item.
Okay, forget that grant then. Let's talk about this.
This is
At
the
least
department
I see a lot.
overview.
Excuse me. Sorry?
This is the department overview,
Okay, I got it. Thank you.
just so we're straight.
Are you done?
Let me write it out for you.
Okay. I see a lot of repetition here and maybe it's me, but I look at this animal cruelty in Sterling, in any municipalities. The police department responds first, and they may or may not ticket because of animal cruelty. I see dog bites, same situation where we had a serious situation in Sterling Heights with pit bulls. We tried to ban them, and there was a big outcry for that. But my question is, these things seem to be like, where do you get involved in when it comes in an animal bite? It goes to the Sterling, let's use Sterling Heights. It goes to Sterling Heights Police Department. They issue a ticket for it. Animal cruelty, they come out, the same situation. Why does it involve the Macomb County Animal Control Officer?
Because what happens is all bites are regulated through the state, right? So all the quarantine that could be done at Macomb County Animal Control, because you're not going to have a place to house it, right? So say there's a really serious dog bite in Sterling Heights, right? You're not going to be able to house it at the police station, right? Which is where you have your shelter license. It has to come to the county, and then it has to be lodged. That bite report has to be filed at the health department. And then it's turned in, we report all that to the state.
Okay. I understand
Same thing
that.
with your cruelty case.
Got it now.
Right.
Okay, the cremation that you do, is there a cost? I'm sure there has to be some sort of cost to the
There is
individual.
a cost. So it's currently $100 for a private cremation.
And when you're putting an animal down?
It would be $75.
That's all I have. Thanks, Chair.
4
Thank
years
you.
ago, it was free.
Thanks, Chief.
Thank you, Commissioner. Next, we have Commissioner Kleinfeld.
Thank you, Chair. Would you please again repeat the two communities that pay and what it is those communities pay for that nobody else does?
Sure. So those two communities would be St. Clair Shores, and starting July 1st will be the city of Roseville. So they're the only two communities that pay for contractual animal control services. So we have an officer that is designated to St. Clair Shores, right? They're out there patrolling just like we do with all the other cities. But the difference is that St. Clair Shores pays for that service. So Clinton Township has an officer, right? But they don't pay. And it's just how when I started, that's what happened. But since I've been here, and new communities wanted to come on, they pay.
Did you indicate that Sterling Heights, because I'm thinking cities versus townships, is this a cities versus townships thing? Or are there cities that don't pay?
Fraser
doesn't pay?
Yeah. Utica.
Okay, well, given, I have to tell you, given the fact that I represent one of those communities, I resent that.
Well, and
I
live in the
resent
Shores.
that there's a double standard and my community's paying and I don't want to pay next year. Since nobody else is paying, I'm just letting you know in the budget next year, I'll be looking to remove that revenue section unless there is a fixing of this situation.
Well, when I started here, that's what we inherited. So the only way to fix it was for those new communities that wanted to come on, someone had to pay because there was no money.
No, I don't have a problem with that,
Right.
but the way to fix it is to then tell the other communities that we're going to start contracting and you have to pay.
I love that idea, and I've tried that for 4 years. So I agree with you.
And if they say no, say okay. Enjoy your cats and dogs and your hogs and your, you know.
I agree with you.
All right.
I would be willing to sit down and talk on that one for sure.
Okay, and then, now this is I'm just curious. There was a vehicle in the St. Clair Shores Parade.
Yes.
What was the cost of that vehicle?
That I don't know. Are you referring to that big truck?
Yes.
Great, because I wanted to talk about that. So in 4 years that I have worked here, we are picking up the deer, and we use that same truck that is not a four-wheel drive. I inherited that truck. And on many occasions during animal cruelty investigations, when we were moving horses out of a farm, just like recently when we
The Expedition, we're talking about the Expedition?
No, we're talking about the Ford 350.
No, I mean, this was it's like an SUV type of thing.
Oh, those are our animal control vehicles.
Okay, so it's an Expedition.
Yes, yes.
So what would be the cost of one of those?
Well, I know to outfit it was, because there's animal cages inside, was $16,000. The actual cost of it, off the top of my head, I don't know. I can get it for you though.
Yeah, I would like that because I looked at that vehicle and that looks like it's more than 50,000, and I just didn't remember.
I know it's not more than 50,000.
Okay.
Yeah, I want to say it was 32 because it's just plain inside, But we had to get it outfitted with metal cages so that we could house the animals in the inside of it.
Okay.
It's
All
a
right.
standard SUV, like the Expedition.
All right. Yeah. Will you get
Yeah.
that cost? Maybe I'm even thinking about something different. Get that cost for me.
Okay, great.
All right, thank you. Thank
you're
you, Chair.
Thank you, Commissioner. Commissioner Smith.
Thank you. Jeff, thank you for your presentation.
Oh, you're
I was a
welcome. Thank you
little,
for inviting me.
I was a little unnerved by the fact that you think that we encourage free thinking.
Right.
I want you to make sure
I'm glad
know
you
that we
do.
don't.
I'm glad you do.
So, real quick, touching on Commissioner Kleinfeld's point, I can't imagine a commissioner around here, paying side or non-paying side, that would be for the system the way it sits right now, and not for saying, cut it out. I mean, listen, the sheriff department works the same way, even though some of our northern communities try to get a little more for their money.
And speaking of your northern communities, right? So if we're up in the northern community and we need service, you have to decide if we're in, MSP territory, or are you with, the sheriff? So it's, for us, we really work this whole entire county other than 4. And we still give those 4 communities backup.
Right, so I would say that if you could find out the logistics behind cutting service to the communities that don't pay, all the while offering them an opportunity to get in on the paying side of things without losing any service if they were willing to do so, I would like you to maybe bring that to us and tell us what that would entail.
Absolutely.
Next, you mentioned partnerships with Missouri and different places like this. Do we do partnerships with MSU? I know they're a big veterinary.
Yeah, we just started. Actually, we just started because they just recently just kind of tapped into shelter medicine.
Okay.
So University of Missouri, University of California, Davis, they're a really big, like probably #1 for shelter medicine. So I've been talking with the professor up there, trying to see what we could do to bring some students down that are going to be in their shelter medicine program.
Great. Spaying and neutering, you mentioned something about a grant to kind of basically get an operating room, for lack of better word.
Correct.
Who does this now? Do you ship this off, and do we pay a contract cost for this? And
Yep, so we have contracted veterinary services, and we have to have our staff drive our animals to the vet clinic, drop them off, and then, later on that day, we have to go pick them back up.
So what would be the cost, though, involved with our own surgical site? Do we have to then hire a veterinarian that could do that, or I mean, is that in the process of your thoughts? I mean, what?
So we
obviously
would,
need to run.
so most of all the equipment is paid for by a grant, right? What the benefit of having the surgical suite would be that we would no longer have to be spending money of having officers transport these animals all around town.
Right.
And then the cost savings would be is we could actually do everything in-house, spay and neutering.
Right.
Not big stuff, but just spay and neutering would be great. And then we could have a vet there, more hours. That would, because right now we only have the vet there for an hour a day.
Seems like you'd be able to show the numbers as a, if
Oh,
not
absolutely.
worst case wash, but best case
Yeah, and how much
savings,
we spend at the vet clinic versus, we could keep all that, saved revenue, I think, in-house.
Okay, that's it. Thank you.
You're welcome.
Thank you. Next on the list, we have Commissioner Lucido.
Hi, Jeff.
Hi, how are you?
If any of you haven't been over there, I'm sure you probably have. It's an amazing facility. I've been over a few times with Jeff, and he's taken me around, shown me everything, and it's top-notch. You guys do a great job. I wanted to touch on that, and that I know we've talked, and you've helped organize and help Wayne County a lot, too. They call on you quite a bit for advice, so I just wanted to commend you for that. Also, on the work you guys do on grants, which saves our county money. I know you guys spend a lot of time working on those grants.
Yes, thank you very much.
You started to talk about one of the vehicles you use when you do, when you go in and you have to take the big animals,
Right.
but you didn't finish.
Oh.
Because Veronica was talking about the expedition.
Yes. So what happened was we would go up to the northern part of the county especially. So I inherited this truck that we use actually to pick up deer and large carcasses off the road. And we use that same truck to pull a livestock trailer. And in several cases, that truck would get stuck and we'd have to unload all these animals into the side of a road and then wait for my family or like Wolcott Mill to come over with a big 10-horse trailer, and we had to reload them on the side of a road, which is extremely dangerous. So I said, this is it. If we're gonna be doing this, we need a truck that can pull livestock, and I'll apply for a grant to try to get the trailer portion, but they couldn't get one to cover the truck part. And so we actually did end up getting a new truck, like a F-150. And I thought, and we put it in the parade. So I
Very
thought that
good.
was really interesting. I wanted people to see because I was so embarrassed that I had to unload all these horses. It doesn't, one time it was in the winter and we had to, release them into a field and then try to recatch them and get Wolcott Mill out there to help us trailer them back.
Well, we're fortunate because I know you have family that have taken in animals and helped
Right.
out in different situations too.
Yeah, my
So,
family came with a 10-horse trailer
Yeah.
on that one.
I mean, that's amazing. We're fortunate for that as well. And also, I wanted to mention, you've talked a lot about Macomb Community College and how the vet program, you work together with them. I know you were asking about Michigan State, and I just wanted you to touch on that a little bit.
Yeah, so I developed that relationship when I first started in 2013. So we give their vet tech program probably about 6 dogs, 6 cats, every few weeks during their semester. So the students learn how to draw blood and restrain the animals, and then they spay and neuter, do all the medical care. So we actually pay nothing for that. They do all the medical care, and then they bring the animals back to us, and then we adopt them out. So it's a really amazing program, and we do the same thing with Baker College. So we're trying now to work up something with, and then we also worked with Wayne Community College. They would take 15 dogs for us a semester, and they would house them, and they do all their medical care and spay and neutering. So that was really amazing. That you figure that was hundreds of animals throughout a year that we are able to allow vet tech students to have this amazing experience, and then do this great service, and then we could adopt them out, and the county actually saved a lot of expense from that.
And also, I wanted to touch base on the Gibraltar. I know you guys do a lot of adoption through there, and is it free, or there's a small fee?
They're usually relatively small fees over at Gibraltar Trade Center, and that's on every few Saturdays from 10 to 2. The biggest thing that we do, we helped out with the Bissell Empty the Shelter event. So the Bissell Pet Foundation paid for all the adoption fees for anybody that was adopting on a specific day. We just emptied the entire shelter.
Amazing.
This is our 3rd time participating in that program.
And when's the next one?
We don't know yet. They didn't announce it, but
Okay.
usually it was only once a year, and then last year we did twice. And then this year we just had our first one. So I think they're going to do it again probably later in the year.
Okay.
But it's, they pay for a lot of that stuff, so it's great. So I always look, and I know Michael works extremely hard, as well, looking for all the grants or all the things that we could participate in to market our animals and get them out there.
And save the community money too.
Exactly.
So thank you. And the next time you do have that, let us know, and we can try and get the word out too.
Oh, thank you. I appreciate that.
Okay, thanks.
Thank you. Commissioner Brown.
Thank you. Is it legal for people on their own property to use an air rifle to shoot a raccoon or a groundhog that's underneath their buildings?
I would say no. I just had a meeting with the DNR, and I would definitely say no to that.
Okay.
I know that certain people do have farms, and so on property or land that is deemed to be agricultural, I think, I know my family has a farm, so I know that they do fall under some different laws there.
Okay.
But definitely, I know in the communities that I service that it would be illegal,
What if
to the best of my knowledge.
So if they trap them like in a box cage alive, they call you and you come pick them up?
No. What we do is we try to explain to people that if you have nuisance wildlife, we will give you some amazing deterrents that we know that are proven and they're going to work. If you're trapping wildlife and you're just relocating it throughout the county, the DNR, certainly doesn't. Even though we have a license, it's not something that you're just making it someone else's problem. So our goal is just trying to explain to people how we could give you the deterrents, even come out and talk to you about it, and see where we go from there. And then if it's an ongoing thing, then we will try to help you out, as far as giving you some numbers.
Okay. Deer seem to be a lot more deer out on the roads this year. They all come out to the side of the road to die, and so they lay on the side of the road. And I've had them there I called in one, it took about a week for you guys to get up there to take care of it. You must be busy, but raised my question about your staffing. Do you have enough, how does that work in terms of collecting animals? That you probably spread thin, I'd imagine, but can you explain to me a little about how that works?
Yeah. So for removal of carcasses, Unless it's impeding the traffic, you know, like, or it's in front of a school or something where we really need to get it right away, we usually try, we only are fully staffed on Wednesday. So we try to save everything for Wednesday, and then early in the morning, try to get that person, I mean, they're gonna have, you know, 15 animals at least to go to and pick
Okay.
up.
That's
Yeah.
what they did say, it'd probably be a Wednesday.
Right.
And it was a few days after, it wasn't Wednesday when they called, so it might have been 5 days later, so that makes sense then. Okay.
Right, and it is hard because say you call on a Friday, you know, then they're gonna put it on the list for that following Wednesday. You
Yeah.
know, but like if it's at a school or something, we try to get right out there right away, but we're only fully staffed on Wednesdays.
Okay, all right, thank you. Thank you, Mr. Chairman.
Thank you, Commissioner Brown. Commissioner Drollet.
Thank you, Mr. Chair. Thank you, Chief, for your presentation. A couple quick questions. You had mentioned a lot of the grants that you applied for and received. Can you give me a sense of what % of your operations are funded via grants? Is there?
Well, so grants that we apply for, where we could even find, never pay for operational cost. It's only for remodeling. So most of all the kennels, that was all paid for by grant. Spay and neuter, that was, you know, in the beginning, there was a big portion of it that was paid for by grant money. So the trap, neuter, return program for cats, that a big portion of that's grant money.
Still, it must be a sense of the. If you had to pay for that with operations money, if you didn't have those grants, I mean, what % of your overall services are essentially are grant funded? Is it? I know that it may be hard to get a sense of that because it might be things you wouldn't otherwise do if you didn't receive a grant for it.
Right. I mean, I could tell you just like that bank of cages, you know, that's $13,000, and those are just half cages. So earlier this year, we put in a row of cages, and that was like $33,000. But we've covered most of all that with grant money. It would never even be a thought that we could put them in.
Okay. Just trying to get a sense of the value of the grants toward the overall operation is all.
Well, I mean, I guess to me, you know, the value of the grant is like, you know, immeasurable because it paid for remodeling, even though it doesn't pay for administrative fees or anything, it paid for a tremendous amount of spay and neutering. You know, that was the first grant was $150,000, and it was for people that lived in specific areas, little lower income, that we could spay and neuter all their animals for free. And that grant, you know, ran for like a year and a half. That would never have been happening. We could never have done that.
Do dog license fees go toward your department in any way?
They do. They're probably the number one revenue generator.
Are they? Okay.
Right. That's why we always do a big license push, you know.
And finally, the commissioners who've been here continuously probably have heard this story before, but you mentioned that the department's gone from, what was it, 85% kill rate or something like that? 87% 4 years ago to a 90-something percent, 91% non-kill rate? That seems incredibly dramatic in a short period of time. And maybe people who've been here understand the story of that, and I know we don't have a lot of time, but what's the main reason that's happened? I mean, is there some...
The cats, the feral cats.
Has there been just less animals coming in? Has there been more...
I say leadership.
Okay.
I say it's leadership, being innovative in your thinking, and having ideas and partnerships, and having support. Because without the support, it was never going to happen. I still, you know, Mark Delton and I sat with St. Clair County, and you could tell when people want to do stuff. Like the Commissioner was just saying, you know, a big portion of animals that were euthanized were cats. And so the biggest amount of grant money we could get was to do trap, neuter, and return for these cats, because we looked at fact-based research. And
so you trap the cat, you neuter the cat, and you release it back into the wild, essentially?
Correct, yep.
Okay.
Well, back into your backyard.
Right. Well,
When
previously they would have been killed, I assume. The cat would have been kept for a certain number of days. And
Actually, we're going to put them in your car next.
Right.
Okay, so that would be the biggest reason why, you know, that particular program was a major reason then.
Yeah.
Okay.
That's probably one of the biggest factors.
Okay.
Right. But the other part is that, you know, we are treating animals now. So before, with the day when I started, there was no medication in the building. You know, so now we have medication. Now we have vets treating them. And so we're saving lives. We do have animals longer in our care, you know, so that's, you know, sometimes, I guess, because we're medically treating them.
I see.
You know, so it wasn't like time's up, you know.
Right. Okay, well, that answers my questions. Thank you very much.
You're welcome.
Thank you, Commissioner. Last on the list is Commissioner Leonetti.
Thank you, Mr. Chair. Real quick, I want to get back to what Commissioner Kleinfeld and Chair Smith were talking about. And I'm going to take something you said specifically. The trailer that you had and then the need for the Ford F-350. You were able to get the trailer through some grant money, correct?
Not yet, so that's what we're working on.
You're
right
working
now.
on.
Yeah.
But the F-350 that you need to take care of the horses
Right.
and a lot of bigger livestock, that came from your general fund, correct?
Correct.
Okay. St. Clair Shores, one of the cities I represent,
It's my city.
Good. Well, we're contractually, we pay. St.
Right.
Clair Shores pays.
Right.
So in a sense, some of these other communities that aren't paying, St. Clair Shores paid for that Ford F-350 that picked up that horse or whatever you need the livestock for, right? Right?
Well, I guess in a sense, I guess if you looked at it like that, I would think that everyone's paying into it.
I get that.
Right,
No, and
right.
I get that. And I'm not saying that people don't. It's just that I want to get back to what Commissioner Kleinfeld and Chairman Smith said. You even indicated when you first opened up, this is what you inherited. This seemed odd to you. Is there some way you can, because budget's coming up, and I'd like to see if there's some proposal you have so that it's fair, so that, yeah, everybody contributes in, and then I don't have any problem with you buying an F-350 to take care of horses and livestock, because I know, and you know, living in St. Clair Shores, name a place that has a horse in St. Clair Shores. You know anybody?
Right, no, I understand.
I just think that's fair. I just think that's fair. So our budget's going to be starting in August, if I understand correctly. And if possible, if you have an idea if that's fair and appropriate, so that every community pitches in, so that all communities are pitching in for whatever services are needed for animal control, I think that would be great for us to ponder at budget time.
You made my day, so that's great.
All right, well, if you could do that, thank you. Yeah.
Just in response to the St. Clair Shores question, they don't pay for the truck. Their contract's specifically based on the cost of the vehicle that's used in their city and the
Okay.
person that's assigned to their city.
Okay.
So they don't incur any of that additional cost.
Okay, that's good to know. I mean, I want to, but I do think other communities, I think everybody should pitch in. I guess the question I have too is, why would St. Clair Shores and Roseville pay for services? Because if they didn't, you would just do it anyway, wouldn't you?
No,
Okay,
no way.
no.
No way.
Well,
I
you
wouldn't.
you wouldn't do it, but I mean,
And no one would, and we're not even mandated by the state to do it.
okay.
So, because you'll get that too, like a lot of, cities will say, well, we'll just get rid of animal control and you'll have to do it. And no, we don't.
Okay, all right.
I
That,
went to
that
Michigan
makes
State.
me feel better. Okay.
Yeah, so the reason why they're paying is they want this level of service, right?
Okay.
They came to the county and they say, listen, you guys do a great job.
Carabelli.
We want that same service. Well, you're going to be paying for the animal control officer and you're going to be paying for this vehicle, and it's over a 5-year contract.
Okay. Okay, so
Does
I
that
get
make
it.
sense?
That makes me feel better because number one, the community sought it out, and number two, there's a little bit more of a heightened service, and it's particular to that community. That vehicle is used for that community, hence the reason why that vehicle was in the St. Clair Shores Parade.
Right.
Okay. All right.
Yes, exactly.
All right. Gotcha. All right. Thank you, Mr.
Thank
Chair.
you,
But everybody should
Commissioner
pay, so don't
Leonetti.
forget
Yep.
that. It's a good topic.
Last on the list, again, is Commissioner Carabelli.
Thank you. Real quick, just to touch on something. It was brought up that there was a few communities in the north that don't pay for sheriff patrols. So in turn, the sheriff department, we have to have one by, excuse me?
I object, there was no discussion.
Anyways, with that said, we don't need a patrol up there, but you got a call or an emergency, then obviously you got to respond. You, as far as patrolling in communities that don't have your service or request your service, you're doing that at your own volition? Because there's no law saying you have to go to Bruce Township if they're not contracted with you. Or are the townships included in a wider thing because townships are part of a different form of government where cities have funds to perform their own services?
Maybe they pay per
See, there's apples and oranges, and I want to get it straight because townships don't receive Act 51 dollars. Cities receive it.
Right, it's not
Cities
roads, right.
receive, well, hold on a minute. Cities receive funds for animal control and they can do their own licensing, is that correct?
The cities could, but all the cities that we
Okay,
do
cities
it.
could. The ones that don't contract with you, there's no by law do you have to show up to those cities and perform any dog capture, go see if there's any loose dogs running around.
I believe there is. In Clinton Township, we sell their dog licenses.
Okay, let me digress and say it again. If there's a city
Right.
that doesn't pay for your services, you still choose, though, to go look for stray dogs throughout that community. Is that correct or incorrect?
Listen, this is what I know. I know that when I took this over 4 years ago, that someone must have took over Fraser, someone took over Centerline, they already had Utica. That was all done before I started. I've had many, many talks with the Michigan Department of Agriculture and the state regarding this service that was already instituted for them, and they were providing this service. So the only way we could ever do anything, I feel, is either on a contractual basis or if we had a millage.
Okay.
And most other communities have millages.
Okay.
Counties.
So he
Again, I want to
doesn't.
point out that the township's services are part of a program where I believe they either contract with you or not. But if you show up into a city and, like you're saying, they were doing it already before you got here, cut the service off until they want to sign a contract and pay. I mean, that's pretty simple to me.
Right, but my thing is, what would be the difference of, you're saying townships are different, because they're falling under something different, and
There's different funding for townships than there are for cities.
Okay. If you lived in Fraser and you lived in this little city, or even Utica, but you live in Clinton Township, which has a vast majority of the runs. Right.
Yeah, I didn't make the rules up.
Right.
That's just the way that the state government
Right.
laid it out.
I think that if anyone contracts with animal control, everybody should have a contract.
Okay, and people that don't contract with animal control,
Call Oakland.
you shouldn't be going there.
Right.
Fair enough.
At least, yeah, I agree.
And I think that's the point that we're all making here.
And those are great valid points, I think.
Okay, Commissioner Carabelli. Thank you. Commissioner Kleinfeld on the second round.
Thank you. Just probably with respect to that, what we need to get clarification for is, he's correct. Counties get money for some of the services provided to townships. But I don't know what all those are. So
Right.
probably to get clarification for that, because I've not heard, and as a city council member, that we got money specifically for animal control. I've never heard that. So that's something not specific to him that we need to get detailed information from Steve on exactly what the counties do get money for to provide services. Because I agree, in rural areas, there is an absolute reason for that. But when you have an area like Clinton Township that is built up as much or more than cities are, if we're not getting money and they're getting the same amount, they're getting their house dollars, their tax dollars for their homes, then if the county's not getting money for that, that's a discussion that we should have on those situations. But we need to get that information first. Thank you.
Thank you very much. Seeing and hearing any more speakers, we have a motion and support to receive and file the department overview. Can you please vote? And thank you very much, I think. Yes. Next, 7A, Grant Agreement 270, Chief Randazzo. Motion to forward. We have a motion by Romano to forward, support by Lucido. Any comments or questions? Yes. Is that this one?
Oh, here.
Commissioner Kleinfeld.
Thank you, Chair. Quick thing. The original, and Steve, you might be able to help me with this. The original recommended action was to approve the acceptance of the grant in the amount of $10,000 from 270. The actual motion that is on our sheet that came from us is to accept and authorize the reimbursement grant agreement with 270. But the vast majority of these that we get, the motion is to amend the budget to reflect grant money. And I was wondering why in the case of his grants that we don't have motions to amend the budget to reflect the grants?
Is it because it's a reimbursement grant?
It might be,
Yeah.
it might be. I mean, he can.
Oh, yeah.
Even if it is, it would still have to go into the budget.
Yeah, we'll come back with another budget adjustment at the same time once we pass a motion today and we get the grant funds. So so we won't be able to spend the money until we actually do a budget amendment. So we'll come back probably next month for a budget
So what does
amendment.
reimbursement grant mean then? It sounded like they'd
Yeah,
already.
we'll get, so the grant's for 10,000, as I understand.
Right.
The equipment's 13. They have a capital projects budget that the other 3,000 is coming from.
Right, okay.
So we'll get 10,000. We'll increase the capital outlay budget by 10 grand and another 10,000 in donations, probably because it's really not a grant.
The
Okay.
reason why this is an approval, this part right here, and not a budget adjustment is because the organization 270 that awards us the reimbursement grant, we first have to send them verification that the board did approve it. And then, once it's approved, then we'll come back and do a budget. Then we'll know for sure through this process that the board agreed to it. And that's what
Okay.
we're gonna do.
And then just two quick things with respect to the actual grant agreement. One thing. Section 8, where it says the grantee agrees to credit the participation of the foundation as anonymous, and you're probably not going to be doing advertisements or anything, but advertisement, publicity, or public comment related to it, it's not a real big deal, but I think with respect to governmental entities, there's a reason that you have to be open and honest about who you're getting money from, and for what purpose. So I know that's in the agreement, but obviously I said the name of the company here and you said the name, so even though it's in there that we can't do that, we've already done that. Just keep an eye out for that in the future. Thank you.
Thank you. Do we have a motion and support? We have a motion by Leonetti, support by Sauger. Any other comments or questions?
We already had a motion.
We did?
Yeah, Romano and Lucido.
Okay. All in favor? Can you vote, please?
Thank you very much.
Sorry, thank you. B, amendment to community development grant budget increase. Thank you, Chief.
Thank you. And I just want to tell all the new commissioners, you can watch our show. It's on Channel 5 through the entire county. Have a great day.
Do we have a motion and support to amend the community development grant? We have a motion by Kleinfeld, support by Kraft. All in favor? Please vote. Let's vote business. Number 8, correspondence. Do we have a motion and support to receive and file? We have a motion by Kraft, support by Grillette. All in favor, please vote. New business. Any new business from commissioners? Commissioner Kleinfeld.
Just very quickly, and it didn't really apply today because we didn't have people in the audience, but we're doing a lot of presentations, and the presentations go very long, and a lot of the action items go 30 seconds. So we might want to reevaluate which one of those is, whether 7 is in front of 6, because if we do have action items, I hate to have employees sit here for all that time, especially since presentations aren't really a voting item. Those are to educate us.
Yes.
So that might be something we might consider. Thank you.
Thank you very much. Any other new business from commissioners? Any new business from staff? Seeing and hearing none. Public participation. Anybody in the public wishing to speak, going once, going twice, going thrice, hearing and seeing none. That's closed. Chair is ready for a motion to adjourn. Motion by Sauger, support by Drollet. Please vote.
I can see your enthusiasm.
Yes, I'm just thrilled about it. Thank you very much, ladies and gentlemen. And please don't catch the mange.
I'm gonna let her know that I talked to them